Moving now to Capitol Hill, we're pleased to be joined by another New Englander. It's Congressman Joe Courtney, a Democrat from Connecticut. And Congressman, we understand, first of all, that you were actually viewed the Osama bin Laden photos just this morning. I want you to describe what you saw, and do you think they should ever be made public? I know you agree with the president's decision, but should the public ever have an opportunity to view what you saw this morning?
You know, I think that having been briefed by Admiral McCraven and others on the Armed Services Committee, that there was no question in my mind about whether or not the events transpired as they described it. Having the opportunity and the invitation to go over as a member of that committee this morning, I felt obligated to do it because I think it's important to just reinforce the fact that because we live in a world where there's doubters and voices that are always trying to challenge events sometimes that are well accepted. So in any case, I mean, the photographs certainly confirm everything that the president and Admiral McCraven and others described, and I think their decision is the right one. I don't think, again, living in the world that we're in right now, creating the potential for sympathizers and worship, idol worship, is something that really is something that the government should really enable, and I think that the decision that was made was the right one.
Congressman, I want to get you to the issue of health care for a second. You made mention the other day about the fact that Aetna in your state, a big insurer there, is actually decreasing the average cost for plans, for the premiums. You're saying that this is a direct result of the health care reform
Absolutely.
legislation that you voted for. But here's my question for you. Do you think as we go into the 2012 elections then that healthcare reform is going to be an issue that is a positive for Democrats and that they're going to actually run boasting about healthcare?
I'm not sure, though, people will be boasting about it, but the notion that repeal, which obviously was riding high leading into 2010's election day, as events unfold and as families and businesses begin to feel the benefits of the changes that bill, which was a very complex bill, is unfolding. And again, that decision by Aetna to cut those rates was directly related to the medical loss ratio rules, which is a reform that is pro-patient, pro-payer, that says that insurance companies have to spend up to 80 to 85% of the premium dollar on actually health care delivery. That, again, is going to result in real savings, actual rebates to small businesses and payers of health insurance. So when the voices of repeal, which again I think are already starting to lose a lot of their energy, even just in the last few months or so, if they try and sort of play that one-trick pony again, leading into 2012, I mean, the fact of the matter is that people don't want to have insurance rates, again, set with no provision for consumer protection, patient protection, that seniors should be able to get their checkups, annual checkups covered, their cancer screenings covered, that the donut hole, the prescription donut hole should be closed. Families should be able to keep their kids up to age 26. I mean, these are things that families and individuals and businesses are feeling with each passing day, and I do think it's going to build up a momentum where that issue probably will be neutralized, Amy, going into the 2012 election.
In our last 30 seconds here, Medicare, Republicans put out a proposal, very controversial. How is that playing, and what do you think the impact will be? Will Democrats win back the House because of the Medicare issue?
I think we should, because it is, again, a provision that is so out of sync with the needs of families. Just to give you a perfect example, I'm 58 years old. Under that proposal, I would still be under traditional Medicare. My wife, Audrey, is 51. She would be left to fend it. I mean, the unfairness of a two-tiered system, which you can just pull, every family can really run the numbers and see this, is something that really, I think, disqualifies them as a governing majority.
All right, Congressman Joe Courtney, Democrat from Connecticut. You heard it here. We should win back the House based on this. Thanks so much for being here. Really appreciate it.
Thanks, Rick. Okay, see you.
Thanks. We forgot to ask him if he's a Yankee or Red Sox fan.
Oh, that's the question for Connecticuters. We're the only one right answer to that question, though.